Well, in your Health Watch, almost half of U.S. adults have high blood pressure, and we're getting new 2025 guidelines from the AHA and American College of Cardiology. They say there are three components for prevention: earlier treatment, personal risk assessments, and closer management during pregnancy. So joining me now is Dr. Lindsey Fish to explain what this means for you. We appreciate you always, Dr. Fish.
Thank you.
Thank you so much. Okay, so can you break down those guidelines and what has changed this year?
Yeah, so the first thing is really in the detection of high blood pressure, where now providers are recommended that they use the American Heart Association's Prevent calculator, which takes into account not just the blood pressure number, but other factors like patients' metabolic health and other risk factors to really determine what their risks are. There's new recommendations, too, if you get diagnosed with high blood pressure, about doing some additional testing to make sure there's not an underlying cause that we need to evaluate and treat differently than just the number. And same thing for treatment. While we always recommend lifestyle changes, lots more personalized sort of recommendations in terms of which medications we pick depending on the patient and the risk factors. And as you mentioned, pregnancy is a big thing. And really, we need to start watching blood pressure much more closely during pregnancy and after delivery to prevent complications for both mom and baby. And those are included in these recommendations.
Really important. So let's talk about these new guidelines. Why do they matter now for us?
So you mentioned in the introduction, nearly half of U.S. adults have high blood pressure, and it is the leading preventable contributing factor to heart disease, stroke, and kidney damage. We also know that it contributes significantly to memory loss and dementia. So lots of bad things if we're not doing a good job taking care of it. So earlier detection, more effective treatment, and really focused on the patient in front of us is so important to prevent those things.
Very incredibly important. What is Denver Health? Let's talk about Denver Health. What is Denver Health doing to support patients in managing their high blood pressure? They find out they have high blood pressure. What can they do? And what does Denver Health do?
Absolutely. So it's about early detection, it's about prevention if you can prevent it, and then appropriate treatment. So first of all, talk to your primary care doctor as soon as you can about this so you can be evaluated. We have the ability to help people understand how to take blood pressures at home. We offer lifestyle classes for how we can, make changes in our lifestyle to help manage it and prevent it. And then we have lots of coordinated care for our pregnant patients.
Which is so important. Dr. Fish, thank you so much for all you do. We appreciate you and your time. And we'll see you again next Thursday.
Sounds good.